Much, and thank you for having me. And it's always great to hear about the great work that other groups are doing. I love being able to. Is this sharing properly? Can you all hear or see?
Yes.
Yes. Yes. Yes. Okay. Sorry, the Zoom just asked me to reshare, so wanted to make sure everyone could see. So anyway, so great to hear about the work that you're doing, Kristen. Always a pleasure to co-present with you. So most of you are probably at least somewhat familiar with Truth Initiative as an organization, probably mostly through our youth and young adult public education, the Truth Campaign, long running, mostly youth prevention focused, although recently pivoting toward cessation, and we'll talk more about why. And but there are also lots of other components of the Truth Initiative that you may not be as familiar with, including what we'll be focusing on today, which is our innovation center that develops digital tobacco cessation programs. We have the X program, which is our long-running adult cessation program, developed in partnership and collaboration with the Mayo Clinic. And we also have This Is Quitting, which will be the focus of what I'm talking about here today. So I won't belabor the problem too much. You're all readily familiar with it already. But of course, we have a youth vaping epidemic on our hands, huge surges among young people, of course, dramatic increases among high school students in particular, but also among young adults. And so I know that came up as a question about, what cessation resources are available for young adults, because we are seeing a huge increase among youth and young adults when it comes to vaping. Sadly, a lot of young people still don't know that e-cigarettes almost always contain nicotine, and that makes our jobs all a little bit harder because some young people are like, I don't understand why it's so hard to quit, because they don't actually recognize that there's something addictive happening. We do know that there's a growing wave of movement toward quitting. In an earlier survey, this data was back in 2020. 50% of teenagers report that they would like to quit vaping. We've seen in more recent data, and when we include young adults, it's closer to 2/3 of young people report that they want to quit, and nearly 1/3 have tried to quit in the past year. So 25% of teenagers, but when we include young adults, that number gets even higher. And we've seen that the pandemic has actually contributed to that wave of wanting to quit, and that many, many young people have been making quit attempts during the past year, specifically related to the pandemic. And so we want to be there with an intervention that can help young people as they're embarking on this quit effort. We know that among the young people who have enrolled in This Is Quitting, almost 90% of our users report that they have tried to quit before and have not been able to succeed. So definitely young people are wanting to quit, they're trying to quit, but they're just not finding success. And that is why it's even more important, of course, for all of us to be offering something that can help support them along the way. So back in the fall of 2018, our group started seeing young people talking about quitting online. They were posting on social media, there were subreddits springing up, there were tweets happening. We saw young people posting on Instagram and Tumblr, all over the internet, talking about quitting, asking how to quit, asking for advice or support, asking just if anyone else has even tried to quit. A lot of young people were posting things like, has anyone done this before? I don't know anyone who's been able to quit, or I don't know anyone who's quitting. And so we started seeing more and more that young people had this need and they weren't finding a resource to meet that. So we started to talk one-on-one with young people, as well as doing some deep sort of internet ethnography, so to speak, and came up with the resultant program of This Is Quitting. This Is Quitting is theory-based, it's grounded in best practices, really with the goals of building confidence in young people in their own abilities to quit, reinforcing social norms, reinforcing that lots of young people are quitting. You're not alone, even if you might feel lonely sometimes, and giving people the social support that they wanted and that we know is so impactful for quitting. And we also wanted to, from an academic literature perspective, we would call this support observational learning and grow behavioral capability. But what that actually means in lay language is show people how other people are quitting and help them learn those skills for themselves. The program is tailored based on age. So we have a version for teens and a version for young adults. It's based on the products that a young person tells us that they use, such as Juul or Swarin or anything else, puff bars. And then it's also tailored based on quit date. So a young person can optionally set or reset their quit date as many times as they want, and we tailor messages appropriately based on where they are in the quitting process. The program is designed to be very empathic and supportive. It's a fully automated program. It's a bot, and young people get that. It makes it available 24/7 whenever a young person wants it or needs it, but it is interactive. So some of our messages are designed to be responded to. They ask questions and young people can respond back to them. And other messages allow young people to access on-demand support. So they can text in a keyword to get instant support for stress, cravings, relapse, or if they just want more messages, more motivation, more inspiration, or more tips. And one of the things that I'll be talking more about in this session is how we incorporate messages from other users to really get at that social norm and social support at the same time. It's very easy to enroll in This Is Quitting. All a young person has to do is text in a designated keyword to 88709. We have some nationally available keywords that we promote through the Truth Campaign, which is Ditch Vape, but we also partner with other states, local health, schools, any kind of public health organization to get their own custom keyword, and they can customize the program a little bit. And so young people can just text in any of those designated keywords to get enrolled. Again, they have the option to set a quit date if they feel ready to do so, and they get over 12 weeks of daily scheduled text messages to guide them along their quitting journey. We also bake in evaluation questions. So we're constantly, as similar to what Rescue is doing, we bake in evaluation. So we ask at 2 weeks, 1, 2, and 3 months post-enrollment, how quitting is going and how well the program is working for them. The uptake and engagement for this program has been pretty staggering. We launched this program nationally in January of 2019. And since that time, we've enrolled over 300,000 teens and young adults with really powerful engagement metrics. We see that almost 2/3 of our users are setting a quit date, so they're motivated, they're ready, they want to be quitting. But even a lot of our young people who don't set a quit date, what we see from their text message interactions with us is that they've either quit quite a few weeks ago and they're signing up for the program just to get more support, or perhaps they are quitting, but they don't want to sort of formalize it with a quit date. So that 62% is even a little bit low when we think about the proportion of our users who are actively making a quit attempt. Almost half of our users use any of those extra support keywords. And I think quite interestingly, 67% of our users complete the full program. So about 2/3 of our users are staying enrolled for the full 12 weeks, some even beyond that, to access those on-demand support keywords, because even after their daily scheduled messages have ended, they can still continue to access those on-demand support keywords anytime they want, as long as they're still enrolled. Of course, we see that it's popular, and that's great. Perhaps more importantly, or at least equally as important, is it working? We see some very compelling data. At 2 weeks, over 2/3 of our users are reporting that they're vaping less or not at all anymore. And in a recently published study that we had in JAMA Internal Medicine that just came out a few weeks back, we see that quit rates among young adult e-cigarette users, that study was among 18 to 24-year-olds only, but among those young adult users, quit rates were nearly 40% higher than an assessment-only control group. So very compelling data. We're really, really encouraged and thrilled with these results. Among our general audience, not in the randomized trial, we see abstinence data that really meets or beats smoking cessation program data that than we've seen with young people before. 1/3 of our users report 7-day abstinence at 3 months, and 1 in 5 report 30-day abstinence at 3 months. So again, very, very compelling data. We're really encouraged by it, and we see that young people, of course, are enjoying their success, and that's really powerful for us too. So I want to spend some more time talking about this aspect of young people helping each other, because we know that social support is such an important part of that three-legged stool when it comes to tobacco cessation, right? You have skills and behavioral capability. You have nicotine replacement support or medication for young people for whom that might be an option or might be a good fit, or who can access it. And then you also have that third leg of social support. And so I want to talk more about how we lean in on social support through text messaging, through a program that young people aren't texting with each other, but they're still getting really deep and very broad social support. So we invite all of our users to contribute to the program, right? To pay it forward, to help someone else quit, to submit messages, to add to the program. And almost all of the messages that we have in the program come from other users. So we direct participants to a Google survey at various points throughout the program. The earliest one is 6 days after a young person's quit date. We have also added some survey questions into that Google form. So in addition to contributing a message to help young people give other young people a tip, we also ask some survey questions so that we can start to see what types of messages young people would want to know more information about. And this helps us essentially tailor the way that we incorporate those messages in an appropriate way. So we added some new questions in November of 2019. How do you respond if someone offers you a Juul or an e-cigarette, but you don't want it? When is it the hardest for you to stay off your Juul? And how can your friends and family support you while you're quitting? Just from a methodology perspective, for those who are interested, we took a sample of 100 responses out of the almost 1,000 that we received in a very short 3-week period. And then we did some thematic analysis to inform our product optimization and start to inform how we would incorporate different user-submitted content in different ways. So this was an inductive approach. We identified themes as they presented, right? So we didn't go in with an a priori set of codes. So the data were pretty interesting, how young people respond if someone offers an e-cigarette and they don't want it. Some people say no, some people accept the offer, even though they don't want it, right? 1/5 of our young people who were surveyed, reported that they would just accept it, even if they didn't want to do it. Lots of people admit that they quit or take themselves out of the situation. And then some people try to sort of just pivot the conversation, change the tenor of things to sort of get out of it. When is it the hardest for you to stay off your Juul? This data is pretty interesting. By far the #1 category here was when they're exposed to vaping. And this isn't necessarily pure pressure. This is just a lot of people submitted things like Madison here who said, when others do it around me. So just seeing other young people vaping makes it hard to not do it. And this is really important when we think about how much time young people are spending online, on social media, gaming, where they're seeing other young people who may be vaping, even if they're not being pressured to do it or offered it. But that exposure is just making it hard. Of course, when young people are with friends, when they're in stressful situations, right, especially for young adults here, when they're partying or drinking, and when they're first quitting. And these quotes, young people, being able to take young people's words, straight from their mouths, the way that they talk about it, the way that they say it, we can then fold that back into the messaging. And this is quitting. This isn't me, Megan Jacobs, telling a young person how to quit. This isn't a doctor or a clinician or a parent. These are other young people telling other young people when it's hard for me and what I did to get through that situation. And that social modeling is really, really powerful. We saw some differences between teens and young adults. So notably, teens seem more susceptible to that exposure to vaping, and young adults seem a little bit more susceptible when they're in those stressful or emotional situations. Just some quotes to sort of humanize this for you. We're seeing a lot of young people who are vaping overnight and first thing in the morning, really mirroring what we see in older adult entrenched smokers. And so even if they're not clinically necessarily meeting a definition of addiction, we are seeing patterns that are very, very similar to older adult entrenched tobacco users that really, I think, should compel all of us to be providing as intensive of treatment and a variety of treatment options as if these were older entrenched tobacco users. And then how can friends and family support you while you're quitting? So this was really important for us because we always want to position This Is Quitting as a support person in their life. Many young people save us in their phone as one of their contacts. On Valentine's Day, we get hundreds of incoming like Valentine Bitmojis and Happy Valentine's Day tweets. So even though they know that it's a bot, they still interact with it like it's a person. And so we wanted to know, how can friends and family support you so that we can design This Is Quitting to deliver those same kinds of support. So we see, emotional support, accountability, information, different kinds of themes coming up and ways that we could model our program to deliver on those things. So, for teens, they a little bit more than young adults wanted that accountability and information, and young adults more so than teens wanted that emotional support, but still really high. A quarter of teens said that they wanted that emotional support. Just some examples I can leave up for you so you can see kind of what that means. Emotional support, be happy for me that I'm trying. Don't criticize me if I'm failing. So we wanted to, in light of these, after doing this analysis, we did do some product overhaul. We optimized the program on roughly a quarterly basis. And so the next optimization was an opportunity for us to really deliver on more of that emotional support. Giving care, empathy, love, and trust, and emphasizing encouragement, active listening, reflection, and reassurance. And these are all things that we can do pretty compellingly by text message. So we added a new first message that comes from the program to young people. This has become immediately our most liked message. So young people who heart or tap that they like the message on their phone. This immediately after we incorporated this into the program, started blowing it out of the water. And we think it's specifically because of this. I'm your person. I'm here for you. The whole program is written in first person. It's positioned like a supportive friend. And so we wanted to, convey that we'll be here for you. This is Quitting. I'm here for you. Some of the messages I'm going to pull from other vapors, people who've really gone through this, others from quitting experts, but everything in this program is designed to support you. We've seen really powerful user responses to the program. In addition, the qualitative feedback that we get is incredibly powerful, full of warm fuzzies. Thank you so much. This truly means so much to me. I love it. I love you guys. Keep it up, right? So we see these really positive, powerful responses every day, unsolicited, coming into the inbox, people just loving the program. And we see that through the way that they engage with it, but also the feedback that they give us directly. We ask users as well what they like about the program and what could be better. So we see that young people like that it's a good reminder. They remind me that I'm not alone. I'm not the only one. So we see that social support really coming through, those social norms and social support. They make it feel like someone's there helping me. They keep me in check, that accountability. They're consistent. We send daily messages. They're from real people. They're good tips from real people. So these don't just feel like throwaways. They're real tips that have actually worked. And they help me find a distraction. There's something else to do. We give young people actionable, real things that they can do. And most of those tips are coming directly from other young people. So I'm going to stop here. I know we want to have time for questions and discussion. Thank you so much for the opportunity to share about this program with you and what we're seeing and the ways that we're helping young people. I mentioned that we have these partnerships. If you're interested in learning more about that, you can email help@truthinitiative.org. And of course, I'm going to stay on to answer some questions. I see lots of things to go back to in the chat here.
Thanks so much, Megan. So now again, like last time, we invite everybody to put your questions in the chat box. We are not taking out loud questions. We are just doing it all through the chat box. So Megan, I'm going to let you scroll back to where you were. There was one slide somebody asked about.
Yeah, back to the blue slide that has the ways you were able to remove yourself from the person offering you a vape. Oh, sure. Yeah. My pleasure. A word from Catherine about triggers. I'm not sure what the question is there, but I'm happy to talk more about that if that's something you're interested in.
Okay, so she got that.
Yeah, perfect.
Do y'all collect data by state in terms of the kids who are enrolling?
So we have data in a couple different ways. For our state partners, they have their own designated opt-in keywords, and so that's the best indication of what state a young person is coming from. We of course have the cell phone number, but that's kind of hit or miss, right? I grew up in Michigan. I have 248 area code. I've been living in DC for the past 13 years, and I still have that 248 area code. And even though I live in DC, the cell phone tower that most recently gets pinged when I text into the program is in Baltimore. So, you know, it's not really, that kind of data is not great. It's not very reliable, but the state partners that we have their own opt-in keyword, and that's a better indicator.
Okay.
Go blue, indeed.
So while people are thinking about the questions, I'll just sort of pose a general one to you. I understand that support obviously is a big part. The kids need, and I say kids, I mean teens, youth.
Sure.
You know, they need to feel supported. Is there any other sort of overarching conclusion y'all have drawn about what it really takes to get kids ready to quit vaping?
So if you're talking about, you know, taking young people who aren't wanting to quit or aren't ready to quit yet and getting them to that point. So through the program, we have daily messages for young people who don't set a quit date to help guide them and get them ready to quit. And we use a lot of different strategies. We encourage them to practice quitting in different ways. Some that are very small, like getting through one craving, some that are about preparing their environment, some that are building up their confidence, their belief in their own ability to be able to quit, really showing them that young people can and have been successful, and you can be too. So Mike asks, how many of the kids joining your program admit that they are not only vaping nicotine, but also THC? So that is interesting. We did do some surveying, and I'm going to stop screen sharing for a minute just so you don't all see my horrendous file structure. But I am happy to pull up some data about that. Because we did ask that specific question not too long ago, and I'm happy to share the data. Let me just pull that up. All right. So, in December 2019, we added a question to our opt-in sequence of messages that asked what substance to try to determine what substance young people are vaping, and we received 27,000 responses between December 19th and January 31st. Within that data set, 60% of young people said that they were vaping nicotine only, 2% said they were vaping marijuana only, 36% said they were vaping both.
Thanks.
Sure. So pretty big sample there too. So the outcome of these tools to help teens stop vaping is only good insofar that you get large volumes of kids and the right kids to use it. I completely agree. So how do we get the word out? So at Truth Initiative, we're doing a couple different things. Of course, we're promoting through the Truth Campaign, which is a pretty big megaphone. Truth Campaign is active across a number of different social platforms and multimedia, whether it's TikTok, Instagram, YouTube, like Twitch, anywhere young people are, Truth Campaign is there. And then we also have these partnerships with public health organizations, state and local groups, school districts to help them promote them to the organizations and the young people that they serve. So for example, we have partnerships with a number of different health plans, and they're promoting it to patients that they see in their systems. We're working, with various school districts, they're promoting it, right? So local organizations or local public health groups are always going to, be able to reach their young people in different ways than the Truth Campaign is. And we think and we hope that when we bring those together, that can help us get that kind of broad coverage. Do the techniques work the same for THC users? That is an excellent question. We don't have enough research about THC only vapors and what helps them quit. And to be honest, to my knowledge, the science on quitting THC is pretty nascent. There's not a lot of good evidence about what works generally to help people quit THC or young people specifically. I would love to see some more research come out about that, but I don't have good answers for you about that right now. It's a great question though.
Sorry, Megan, I've got a question for you. And talking about, the strains of mental health and why a lot of kids are vaping is for the anxiety. Is the program set up in any way where if a youth submits messaging that indicates that they're in a mental health crisis, that it gives them some direction about how to get more serious help or more specialized help for a mental health crisis?
Yep. So we have automated messages that respond to a number of different, words that we have sort of like whitelisted, thing related to suicide, killing oneself, self-harm, a variety of different words like that it automates a response back to tell young people and guide them toward nationally available mental health resources, either through crisis text line or a phone helpline. And then we also have someone monitoring our inbox every day. So if a young person sends us a message that isn't in response to another message, but it signals distress, we can respond to that manually as well.
That's great. I believe there's another one in there now.
Yeah. So Megan says, do you ever have issues with this being a mostly phone-based program and getting cravings during school hours? For the past year and a half, that hasn't been much of an issue because everyone's at home. And in the year before that, honestly, it just was not really, I can't say that was a barrier. I don't know. Maybe for the middle school set, that's a little bit harder. I think high schools, a lot of kids have their phones with them between classes or during lunch. So I don't know. We don't send scheduled messages during school hours. We try to avoid that for young people. For people under 18, we don't try not to send messages during school hours, but we do get incoming messages 24 hours a day. So it doesn't seem to be a huge problem.
Okay. Anybody out there have any additional questions for Megan? Well, we thank you very much for your time.
Thank you.